Good afternoon, and I want to welcome you to the University of Chicago Medicine's Community Health Focus Hour. This is Susan Peters with the Office of Community Affairs, and we have a very exciting and interesting show for you today. Today's show topic is sickle cell anemia, the silent killer. This is actually Sickle Cell Anemia Awareness Month, and we haven't been hearing a lot about sickle cell anemia. We've been hearing about many other maladies, but not sickle cell anemia. So today our focus is on bringing to light the effects of sickle cell anemia and the health disparities in our community. Just a little bit of information is that there are between 70 to 100,000 Americans, primarily of African American descent, that are affected by sickle cell anemia. And I have a great group of guests assembled here today to just help us explore this topic. I have Dr. Radhika Peddinti, a pediatrician with the University of Chicago. She is the clinical director of the Sickle Cell Disease Program. I have Tanisha Jones, advanced practice nurse and sickle cell case manager for Rabida's Children's Hospital. And I'm going to just stop right here and let Tanisha explain what the difference is between an advanced practice nurse and a registered nurse.
Pretty much the difference is I am a master's prepared nurse, and nowadays you also can have a doctorate. And I have the skills and the background of registered nurse, along with assisting physicians with seeing patients. I can also carry my own caseload and prescribe medications.
Very good. I wanted to make sure we understood the distinction and the work that she's put into developing herself as a professional. We also have Linda D. Drawhorn, who is a registered nurse, and she is representing the Sickle Cell Disease Association of Illinois. Welcome. And we have Mr. Jamal Stallings, who is a 17-year-old sickle cell patient. So he's going to be able to tell us up close and personal what his life is like. And he's also a member of STRIVE, STRIVE, which is a mentoring and support group for young persons that are dealing with sickle cell disease. So I want to kick it off by just we need an understanding of what is sickle cell disease and how is it diagnosed.
So sickle cell disease or sickle cell anemia is a inherited blood disorder in which red blood cells, which normally are sort of donut shaped, are shaped in the form of a sickle or a C shape. And because of that abnormal shape, the cells tend to break down much more easily. And when they break down more easily, they tend to cause anemia. So normally, if we say hemoglobin numbers in patients will range anywhere from 12 to 14, with sickle cell disease, they are much more anemic with numbers between 7 and 9. So that is the main focus of sickle cell anemia. Besides, what we see is with these donut-shaped normal red blood cells are flowing through the bloodstream, they are flowing, happily and normally, but the sickle cells, which are more C-shaped, tend to clog the bloodstream, and that causes the complications that we see in sickle cell anemia, which is pain crises, which is the most common reason for patients to come into the hospital and to the doctors.
So how can we even become aware that a child might have sickle cell disease or the trait?
So nowadays, since 1989, in the state of Illinois, every baby that is born is tested for a number of diseases, and one of the main ones that we look for is sickle cell. We are looking for sickle cell trait and sickle cell anemia are found on those blood tests, and then the parents are informed within the first couple of weeks that their baby has sickle cell and that they have to see a hematologist. And they are seen within 6 to 8 weeks of birth, and preventive measures are instituted right away.
So this is something pretty new, right? That it wasn't always that way, was it?
No, it was not always that way. Back in the 80s, a group of doctors with interest in sickle cell disease actually were involved in the cooperative study of sickle cell disease funded by the National Institutes of Health. They were looking at the fact that a number of babies born with the disease were dying young of infection. And because of that, they pushed to have a law passed that the children would be tested for sickle cell disease. Now, as the doctor has stated, babies are tested at birth in all 50 states in the United States. And since 1989, in the state of Illinois, we have had sickle cell testing. The babies are tested at birth. Parents will see a Band-Aid on their heel where they get a heel stick, and this blood is sent to the state, to the Illinois Department of Public Health. And they run the test and notify the families. And as a part of newborn screening, the Sickle Cell Disease Association of Illinois, since 2002, has been involved with the state in doing follow-up for infants identified with disease and trait.
So this is the value of advocacy, because what could have happened is children could have just continued dying, and that was just the way it was because they were diagnosed later with sickle cell. So because I want us to come back later on in the show with this question of advocacy and what we can do to create change. So, there are a lot of myths about sickle cell disease. Who gets sickle cell disease and who doesn't get it?
So sickle cell disease, one of the myths that everybody has, it tends to be an African American disease, and that is not the case. Even though primarily what we see is sickle cell is in African American patients, but patients from the Arabic Peninsula, from Mexico, from India, from the Mediterranean, pretty much anybody can get sickle cell disease. In the United States, it tends to be mostly the African Americans, but it is a disease that is prevalent all over the world.
Okay. Well, so how is sickle cell disease diagnosed?
So sickle cell disease, like I said, is, nowadays the diagnosis is made through the newborn screening. And once you've made it through the newborn screening, you know that this patient has sickle cell disease and they need to get plugged in right away to a hematologist. There are times that, especially before 1989, when the universal newborn screening was not in place, it was only diagnosed when a patient presented with a complication. The most common complications in those days was infections. So a baby would come in, be extremely sick from a certain kind of a bacterial infection in the body, and people would go back and then look through a specialized blood test if the patient had sickle cell or not.
Okay.
And that was not the ideal way to find out because you already have the complication.
Right. And then, so tell me what some of the symptoms of somebody, because could there be people like walking in school-age children who have not been diagnosed as having sickle cell?
There are certainly, it's certainly a possibility, even though we are doing it through the newborn screen, informing the parents. People move to other places. People may not have gotten the letter, and people have not plugged in with a hematologist like they should have. So patients can present with, like I said, the hallmark of sickle cell, and that's why it's called sickle cell anemia, is anemia. So a patient can have a hemoglobin number that's lower than what's required for them. When somebody looks under a microscope and looks at these cells, they don't look normal shape. They look in the shape of a C. And so you know that this patient has sickle cell. And those patients can have either the trait or the disease. And then we can do specialized tests to find out which one they have. Patients can sometimes just present to a doctor with an infection, or they can present with a pain crisis. And it's only with the pain crisis that we know. We go back and look at why somebody is having pain and figure out that they have sickle cell. Sometimes sickle cell can affect growth as well, so kids can look much littler than their actual, they should be for their size and age, and that could be another reason for us to figure out when somebody has sickle cell or not.
So let's just restate again, the newborn screening started when now? What year was that?
1989 in the state of Illinois. And one of the issues with the newborn screening in finding the parents after the test is done, a lot of them move. We don't have correct phone numbers, or the phone numbers are disconnected. So it's very important that parents are aware that their babies are being tested and actually go to their pediatricians and inquire about the test results. That's another positive way of finding out whether or not your child was diagnosed with either sickle cell trait, which is a carrier state, or sickle cell disease, or some other disorder.
So across the United States, is the newborn screening done or only in Illinois?
It is done across the United States, in all 50 states, and every baby that is born.
And I also recommend, because I get a lot of calls from parents who get letters from us that state that they just have the trait. And I always encourage them to make sure that they take that letter to their pediatrician that they'll be seeing, to tell that pediatrician that they also have sickle cell trait, that their child has sickle cell trait.
Great. I was actually, and so we'll be coming up on a break pretty soon, but before we do, I want to get a little bit into how potential parents can test themselves prior to getting married to know that two people who have sickle cell trait, they should be aware of that before they get married. Wouldn't you say, Radhika?
Yes, absolutely. I think, what we have to understand is, like I said, sickle cell is an inherited disease, so patients should be aware whether somebody has the trait or not. And one of the ways that they can get tested, they can always go to their doctor to figure out whether they have the trait or not, and they can do the testing there. The Sickle Cell Disease Association of Illinois, I know, offers free testing, and Linda can tell us about that a little bit.
The second Friday of every month, there's a partnership that the Sickle Cell Disease Association has with the University of Illinois at Chicago Sickle Cell Center, where they offer free testing at the office at 8100 Southwestern from 11 a.m. to 1 p.m.
So there's so many inherited things that can be passed through blood. I don't know if there is a rule that you have to get blood tests before you get married. Is that still in effect?
I'm not sure, but I know that sickle cell is not a part of the testing, premarital testing.
So I guess my message to young people who are partnered or intending to get married and potentially have children, they should actually look into whether one or the other of them has a sickle cell trait. Because I actually was looking at a video, and the one young woman was saying that she had no idea that her partner had sickle cell trait, and maybe they would have chosen to do some testing ahead of time had they been aware. So that would be something I would definitely advocate for. So at this time, I want us to go to break, and then when we come back, we'll talk about the treatments for sickle cell anemia. And we are back with the Community Health Focus Hour, and I want to invite our listeners to call in at 773-591-1690. That's 773-591-1690. If you want to weigh into this conversation about sickle cell anemia. We have been discussing the causes of sickle cell anemia, myths about it, who is prone to getting it, newborn testing, and now we want to talk a little bit about the treatments for sickle cell anemia, because we are moving into an era where the prognosis for persons with sickle cell is infinitely better than it was in the past. So can we talk a little bit, Radhika, about Radhika and Tanisha, about some of the treatments?
Absolutely. So in terms of, just care for sickle cell disease, I'm just going to step back for a second. Putting those preventive measures in place, like I said, with sickle cell anemia, the infection risk is pretty high. So getting them started on penicillin very early, establishing a relationship with a hematologist and seeing them regularly are extremely important. And the reason they're important is because there's a lot of stuff sort of coming down the pike in terms of treatment for sickle cell anemia. One of the big ones that we talk about is hydroxyurea. It's a medication that you take every single day by mouth, and it's safe in children as young as 9 to 10 months now. And what it does is, in babies, when they're initially born in the first 6 months of life, babies tend to have really, besides the infections, not many problems with sickle cell, like pain and things like that. And the reason is they have this protective hemoglobin in their body, and that hemoglobin is called the fetal hemoglobin. With time, that fetal hemoglobin sort of starts to disappear. Hydroxyurea is a medication that makes your body make that fetal hemoglobin again, and that gives you immense protection against sickle cell. And so that's sort of one of the most successful controller medications that we have for sickle cell right now.
So are there side effects? And if there are, what would they be?
So, it is a medication that actually has minimal side effects. One of the ones that we do look for is a decrease in the white blood cell count. White blood cell counts are cells that help fight against infection, and sometimes hydroxyurea can bring that count down. So what's important is once you start on that medication, the first couple of months, you have to make sure that you go in for regular blood tests so that it can be monitored. But once you're able to tolerate it well, it has an extremely high rate of efficiency, so people respond and have protection from these pain crises that tends to really hamper quality of life.
So during the break, we were talking a little bit about the different types of sickle cell disease. Did you kind of want to go into that now?
So, when we were talking about the testing for sickle cell trait, the sickle cell trait that tends to be sort of the most common one that we talk about the most is the sickle S type. And when you have sickle cell disease, the one that's most common, 70% of sickle cell disease tends to be sickle cell anemia with SS, but there are many other types of sickle cell disease. It's a big umbrella, and you have diseases like SC, there is S beta plus thalassemia, there is S beta 0 thalassemia, and the best way for somebody to get tested to know exactly what they have, when I was speaking about the specialized blood test, is something called the electrophoresis. It's, sometimes there is a screening test that's done, which only tells us whether you have the sickle S trait or not, but it doesn't pick up other types of traits. So it's very important to get a electrophoresis, which tells you whether or not you have any other subtypes as well.
So based upon the various types of sickle cell, and Tanisha, feel free to jump in here as well, are the treatments different, or is one more difficult to treat than the other?
So patients that have SS tend to be the ones that have the most severe disease. So when we talk about sickle cell, most of the time that's the one we seem to bring to the forefront. But having said that, any other patient with sickle cell can have the similar types of manifestations and be eligible for any of these treatments that we are talking about.
Okay. I feel like I'm getting a wonderful education here. This has been quite a blessing for me. So Jamal, I'm going to bring Jamal in to talk a little bit about how hydroxyurea, I hope I've said it correctly, hydroxyurea has affected him and what his experience has been. Jamal is 17 years old, doing very well. And so for me, I'm looking across at a very handsome young man.
Oh, thank you.
And I'd like to give him a chance to share what he's been challenged with and how he's handling it.
So, like they have said, hydroxyurea is important for the blood count and things like that. It does help you stop pain. I know this from experience. Let's see. A couple of years ago, I lost my mother to colon cancer, and during that time, I was depressed, and I felt like I shouldn't take my medicine anymore. And then when that was happening, the fetal hemoglobin would start getting lower and lower, and I was being hospitalized a lot. So then that's when Dr. Peddinti and Tanisha decided to get on me. When I say on me, like they decided to get on me about taking hydroxyurea. Now I'm glad to say I've been taking it as much as I should now, and it's really, really helped me. I haven't been hospitalized for about 6 months now, almost a year.
Yeah.
So I just want to say it does help, and and having sickle cell, I want to get into this a little bit. Having sickle cell, it's very important when you're in school to keep your grades up, because in a sickle cell crisis can strike at any moment. It affects the weather, like if it goes from like how Chicago has been in the couple of days, it goes from very, very hot to very, very cold in a split second. and
Yeah.
yeah, and and that could cause a crisis because one day because your body is adjusting to the temperature, that could cause a sickle cell crisis. Let's say the rain that's been going on, if you get wet in the rain or if you get cold in the rain, like I said before, you can have a sickle cell crisis. So being in school, it's important to keep your grades up because you never know when you're going to miss that day. So, yeah.
Well, that is good guidance for everybody, actually, but particularly for young people who are dealing with sickle cell. And so, how do you cope with the pain, which I understand strikes in your joints?
Yeah. Well, the things I do is I take my pain medicine. They give us pain medicine to how bad that crises depend on. So I take my pain medicine. I use a heating pad, which is if you don't know, it's a pad that has a type of heat source in it. It's electrical, so I use that, and sometimes the heat can help relieve the pain. It's because it just kind of breaks apart. It's kind of hard to explain what the heating pad does, but yeah, I do that, and I make sure I drink a lot of water.
A lot of fluids to keep
Yeah.
hydrated.
Yeah.
Wow. This is, like I said, I feel like I'm getting a great education. And so, in addition to the drug therapy, are there any other therapies that I heard a little bit about? Transplants, bone marrow transplants. Can we talk a little bit about that now?
Yes. So, I talked about hydroxyurea as being a controller therapy for sickle cell, meaning you have to take it every single day. It keeps your disease under control. Bone marrow transplant tends to be it is the cure for sickle cell. Bone marrow is the factory where all the red blood cells are being made. And in this factory, the sickle cells are being made as well. So in bone marrow transplant, if we can give medications to a patient who has sickle cell disease that sort of wipes out their bone marrow and makes the soil fertile for us to give some other person's bone marrow, and the most ideal person would be a sibling who has, the same sort of matching. There is a specialized matching that's done, and that person does not have sickle cell disease, then the bone marrow, starts to make cells that the other person would make, which would be normal red blood cells. And so the sickle cell has essentially been wiped out. And that's what a bone marrow transplant is.
So, what is the future of bone marrow transplantation? Because is it something that's done commonly now or not so much?
So it's not very common. So when we were talking about numbers, we said 70,000 patients with sickle cell are living at this point, at any given point. So if you think about severity, not everybody is eligible for a bone marrow transplant. If you have severe sickle cell disease, you have many, many symptoms, you're eligible for a bone marrow transplant. So about 5,000 to 7,000 patients would be eligible. We have about 600 to 700 transplants that are done. So it's an extremely underutilized treatment modality at this point. And one of the barriers is, like I said, the most successful transplants are matched sibling transplants. But what's coming down the pike is, for you to get what's called an unrelated donor transplant and cord blood transplants. And this is something very much worth talking to your physician about and getting to know more about, because it's getting safer, and there are many, many ways of doing transplants than the traditional way in which you had to be in the hospital for many, many, many days.
So this is very interesting. I'm a person who thinks into the future, and I've heard about cord blood transplants, and if I'm correct, that is the blood that comes from the placenta when the child is born. Is that correct?
That's correct.
So so should more women donate that or save that? How is there a way for us to be active in making sure there's more cord blood available?
There is definitely a need to spread the awareness in terms of banking the cord blood, and always talking to your obstetrician about banking cord blood, I think, is a good idea for you to be able to find a bank in which it can be stored. There are multiple ways of storing it. Either you can store it to say that I need it for my child in the future, or I'm just going to donate it so that it can be used for anybody that needs it in the future.
Okay, this is again interesting. I want to switch over to Tanisha a little bit, And Tanisha, can you talk about what you do in the realm of sickle cell disease and how you and Jamal and Radhika might work together around his keeping him healthy and safe?
Yes, so my role is both the advanced practice nurse and a case manager. And basically, I assist with seeing patients with Dr. Peddinti in clinic and also rounds with physicians in consults and inpatient units. I also do a lot of coordinating care, of setting up appointments, and do a lot of phone calls to make sure that my patients are taking their medications appropriately and also coming to appointments on a regular basis. What happens during a clinic visit is I will go in and first talk to the patients to see how compliant they are with taking their hydroxyurea. If you talk to any of my patients, I pretty much just stay on them about
This is true. This is true.
Jamal agrees.
compliance and encourage them to let them know that if you take the medicine like you can be very successful. And I think that's one of the things that I like to get across to my patients with sickle cell is that even though you have sickle cell, you can still live a great life, especially with the use of hydroxyurea.
Wow, I'm really excited about the prospects because initially when I started reading about sickle cell disease, what I was hearing was that people with sickle cell really weren't having a good lifespan. So I think through increased education, we are seeing more. I actually have a call and it's Kumi on the south side. So we're gonna let Kumi speak. Good afternoon, Kumi. This is the Community Health Focus Hour. Would you like to share something with us?
Sure. Good afternoon. My name is Kumi Sobowale. I'm a med student at the University of Chicago, and I recently had the opportunity to write a piece about sickle cell disease, focusing on sickle cell disease during this month of awareness. And the article focused mostly on the current state of sickle cell in terms of research funding, and then also focused on the things that people can do to support sickle cell disease. And this kind of came out of the Ice Bucket Challenge, which is not something that's very easy for people with sickle cell disease to do,
Yes.
because it's very cold and that can cause some pain. But just wanted to hopefully start something similar for sickle cell disease, encourage people to give blood, which can be done almost anywhere around the country through the American Red Cross and other organizations. And then if they wanted to donate, it's very easy to donate to the Sickle Cell Disease Foundation of America, so Association of America, rather. So if people want, whether they want to give money or they want to donate blood to support people dealing with sickle cell, it's something that could be done pretty easily. So I encourage everyone to do that.
So, Kumi, I want to thank you for your call and for writing that wonderful op-ed piece, which really gave me a lot of inspiration as we went into this show. I also have a call from Wilson. Wilson is in Hazelcrest. Wilson, would you pose your question?
Yes, ma'am. I've got a question. I think you call it oxyurea. Is that correct?
Hydroxyurea.
Yeah. My question is this. Is that drug only for insurance patients, or is it for the low-income public aid patient? And my reason for saying that is this. I think that disease state, sickle cell, affects more low-income patients than the higher-end group, okay? If so, is it available? And then I can understand, I think Jesse Jackson Sr. has had sickle cell. I remember years ago he was stating it, but this is the first time I heard of this newer drug. I'm ex-pharmaceuticals for years, but I've never heard of it. But can you make a comment on that, please?
So we're going to have our doctor discuss this with you, and but I see her nodding her head. So take it away.
Yes. So hydroxyurea is available to everybody. It is not just for the high-income insured patients. It's also available for public aid patients. A lot of the patients that we take care of at Rabida that are on hydroxyurea are actually on public aid as well.
So great. Thank you very much for that. So we're going to go to break, and when we come back, we're going to talk a little bit more about advocacy and support. But please give us a call. The number is 773-591-1690. Welcome back to the Community Health Focus Hour. And we're going to return a little bit to this idea of bone marrow transplant. I want to ask Nurse Tanisha Jones to talk a little bit about bone marrow transplant.
One of the things that I would like to raise awareness about is we talked about bone marrow transplant being better when you have a sibling match donor. But as Radhika stated, we also are trying to do unrelated. One of the problems that we run across on the bone marrow registry is that not a lot of African Americans are on the registry. So when you go and donate blood, you can always ask to go and donate and be part of the bone marrow registry. Once we get a large population of African Americans on, or any minorities on the bone marrow transplant registry, that will give life to more of our sickle cell patients to be able to get unrelated bone marrow transplants.
I love that last statement, that will be able to give life, because someone who is taking medication every single day, to be relieved of that would be such a wonderful blessing, and that's a gift that that many of us can give. So thank you for bringing that forward as an idea. We want to talk in this segment about support and hope for sickle cell patients, and definitely bone marrow transplantation is one of those support and hope aspects. I want to talk a little bit to Linda Drawhorn and Jamal about this. And Linda, you are with the Sickle Cell Disease Association of Illinois, and you had indicated to me that you started as a registered nurse. You were at the University of Chicago, and then you saw some things with patients that just kind of touched your soul and made you know you always needed to be involved. Do you want to talk a little bit about that, and then we'll move into the support that you give through the Sickle Cell Association of Illinois and disparity and all of that?
Yes, as you've described, I have a passion for sickle cell, and I want to see cures, and I want to see the patients to have the best quality of care. I became involved in 1985. I really didn't know a lot about sickle cell because in nursing school we got one paragraph about it. And when I was working at the hospital and a position came open for a nurse associate to work with sickle cell in the cooperative study of sickle cell disease, I said, well, let me give it a try. And I did my own research. I took the position and I started working with the patients. And I saw a need. And since 1985, I have been totally involved, advocating and been involved with the Sickle Cell Disease Association of Illinois, going to camp with the kids, doing everything, trying to help them to gain this wonderful quality of life. The Sickle Cell Disease Association of Illinois, the mission is to enhance the quality of life for people with sickle cell disease and their families. And to achieve this goal, the organization acts as an advocate for improved health care and services for sickle cell patients by educating and informing the community through outreach programs. They have an advisory support group for patients affected with sickle cell disease and their families that happens the second Thursday of the month. And for individuals who are unable to physically be there, there is a call-in number that they can call and participate in this session. It occurs from 6 to 8 p.m. As I stated, they also do testing for sickle cell on the second Friday of each month from 11 a.m. to 1. They're involved in the newborn screening program, which is very, very important, and they help the state with doing follow-up services for infants who test positive for sickle cell disease, including support, and they do some home visits for those patients who are difficult or hard to follow up for the state, and they help to coordinate their care. They conduct educational events as part of newborn screening, and one is the health professionals' annual Management of Sickle Cell Disease Conference.
Wow, there is a lot going on through the Sickle Cell Disease Association of Illinois, and I understand that there's a camp that you guys are fundraising for as we speak, right?
Yes, right now the rest of the staff is in Frankfort, Illinois at the 12th annual golf outing, raising funds for the summer camp. Summer camp happens every July, and we take up to 60 children with sickle cell disease to Hudson, Illinois for a week. It is to give them the opportunity to meet others with sickle cell disease and to participate in lots of different activities. The organization also provides counseling and referral services and direct medical emergency grants to patients in need of medication, equipment, transportation, and other medical necessities. And coming up, the holiday season, they have a holiday celebration for children with sickle cell disease 0 to 17 years of age. And as of October 1st, they will begin their toy drive or gift certificate drive to have the gifts to give to these individuals.
So I'm actually going to ask you to give me this calendar of dates so I can post it on the Community Health Focus page, because that's something I'd like people to be able to reference. And do you have a phone number that people can call to get information?
Yes, it's 773-526-5016.
You want to say that again?
773-526-5016.
And so regarding this camp, Jamal, have you ever been to the sickle cell camp?
Oh, yes, I have.
Okay, well, elaborate.
So, the sickle cell camp is, like she said, it's a chance for children that have sickle cell disease can get together, interact, and do fun activities. I have, when I was I'm too old for the camp now, but yeah, sad face. But yeah, when I was at the camp, it was a chance for me to meet new friends and opportunities. I still talk to some of the people that I used to go to camp with to this day. So yeah, it was fun.
Wow. And then were you a part of any of the other activities or just the camp?
I was part of the camp. We would try to make the Christmas activities. We would try basically everything is SCDAI. SCDAI put on me and my mom or my family. We always try to go there and try to make it.
Wonderful. I guess, it's always good to have support and to be around people who are dealing with the same stuff you're dealing with. So the Sickle Cell Disease Association of Illinois, or SCDAI, is really an important part of your life.
Yeah.
And so can we talk a little bit about the disparity in funding for sickle cell disease? Who wants to tackle that?
I can talk about it. Having been on Capitol Hill several times to advocate for funding and improvements in care for sickle cell, I want everyone to know that what I learned was from the senators and the representatives that seeing the faces of the individuals affected with sickle cell and hearing their stories mean more to Congress than any of us health professionals coming there. They can tell the story better than we can, much better than we can. The funding for sickle cell disease there is a great disparity in the funding for sickle cell disease. We talked about newborn screening, but the patients live a long time. The individuals live much longer. So we have to look at what's happening with research and care and for these individuals who are living much longer than before. What are we doing to improve that, to prepare the health professionals to care for them? We have the pediatricians, but what happens when they get to be an adult? We need hematologists and internists and other people who will care for them. And they began in 2004, there was the Sickle Cell Treatment Act that was passed to have funding to increase that quality and the access of care for not only the pediatric patients, but the adult patients. Well, that funding is now up for reauthorization, meaning that the federal budget doesn't have money there anymore. So it is the Sickle Cell Treatment Reauthorization Act of 2014 was introduced in July of this year to the House of Representatives by Danny K. Davis and Michael Burgess of Tennessee. And the goal of this is to renew the nation's programs for research, surveillance, prevention, and treatment of sickle cell disease for another 4 years to get this funding. The next step with that is to secure introduction of the bill in the Senate and to have it passed. So we'll need support with that. The great disparity in federal funding, well, we can look at there's less public and professional support for sickle cell disease as compared to other less prevalent diseases. The National Institutes of Health provides almost 4 times more funding per person affected with cystic fibrosis as it does for persons affected by sickle cell disease. As we talked about, there are like 70 or 100,000 individuals in the U.S. affected by sickle cell compared to 30,000 affected by cystic fibrosis, but yet they provide 4 times more funding for cystic fibrosis. And cystic fibrosis is less prevalent, and sickle cell disease has a substantial public health impact.
So I'm here in the room with you, feeling your passion and seeing you hit this table, because this is really important, not only to you but to all of us. Yes. And I want to know, as a citizen, how can I help?
As a citizen, I think advocacy, contacting Representative Davis and letting him know that you support him, and to thank him for going. For individuals affected by sickle cell disease, you have to let your voices be heard. You have to speak up for yourself, and you need your community support. We can't do it all for you. You have to help us.
So I'm looking across at Jamal and realizing that he is a pediatric patient. When will he become an adult patient and be out of the protective arms of Tanisha Jones and Dr. Radhika Peddinti?
So unfortunately, when Jamal graduates, which is in May 22nd, he will be transitioned out of Rabida. I would say that the good thing about Rabida and the University of Chicago is that Radhika in the University of Chicago has decided to do a young adult clinic.
Wonderful.
To where we are now transitioning. Well, I always say you transition out of myself in Rabida, but you continue to see Dr. Peddinti at the University of Chicago. Along with seeing Dr. Peddinti, slowly over the course of the years, they will bring the adult hematologist from the university into clinic to also start seeing the patients. So it's kind of a collaborative, so we're just not pushing them out into the world, kind of from going from cuddling them as pediatric patients to being adult patients.
That is wonderful, and this is one of my moments of being proud of where I work at the University of Chicago Medicine. Because the patients are being transitioned as opposed to not being able to get comprehensive care. I had a Facebook post this morning from my friend Felton in the south suburbs, and he said sickle cell needs a viral fundraising idea that can cross over like ALS. We've got 2 more minutes to go, so I just wanted to make sure we said that. And I wanted to encourage everyone to donate to sickle cell. I think how we can help, Linda has said, we can call Danny Davis, Congressman Danny Davis, and both thank him and encourage him. We've heard that we can become bone marrow donors. And we can give money to the Sickle Cell Disease Association of Illinois. So I never like to ask somebody to do something that I'm unwilling to do. And we have not discussed this, but I do have a small check sitting over here that I'm going to give to Linda, because I think the way we encourage a behavior is to model that behavior. And this has been a great blessing for me to meet Jamal and to meet all of you and to know that we need to be doing something for sickle cell. So if everybody can just give me a word, I'm